I'm Florence Sharman, and my mental illness journey has been a rollercoaster ride. My experience started when I was just 8 years old, which I'm sure many of you are probably shocked to hear that someone at such a young age can have a mental breakdown. But sadly, I'm not the only one. My life completely changed. It was a very rare experience that happened to me because it all happened with physical symptoms one evening. A night I will never ever forget. Within an 8 to 12 week period, I went from being a happy-go-lucky child who loved life and had everything to look forward to a little girl who was terrified of everything, not wanting to live, thinking everyone was better off without her, and I lost my childhood because of it. No child should lose their childhood because of what their mind is doing to them. Within an 8-month period, I was diagnosed with 4 mental illnesses, those being PTSD, OCD, clinical depression, and panic attacks.
3/4 of the people who develop a mental health disorder will do so by the time they turn 18. We know that kind of adolescence period is the big time when the mental health emerges. It's often the factors and what the experience is before that point in childhood that we're then interested in really trying to understand and tackle to prevent kind of that starting. We kind of have a relatively good understanding now of factors that might protect young people. We're not so good at understanding how we translate those into interventions, but also we know that not all interventions will work for everybody. So really trying to understand which children would benefit most from certain interventions is one of the biggest questions that we definitely need to tackle.
We didn't know what caused my life-changing mental breakdown that came at the age of 8, and it took 8.5 years for us to know the cause. And that, as you've probably all guessed it, is because of the lack of research and funding into mental illness.
We know that it's severely underfunded compared to the funding that physical health gets, and we know so little about what puts young people at risk and what can protect them and what interventions are effective that we need a huge amount more research to understand that going forwards.
It's life-saving and it's life-changing. I can't turn back the clock, I can't change what's happened to me, but I can help raise awareness of the importance of research.